Breast cancer. It is the most common cancer among women worldwide, although it can also occur in men, though it is rare. Causes and risk factors. The exact cause of breast cancer is unclear, but there are certain risk factors that can increase a person's likelihood of developing the disease. While having one or more risk factors does not guarantee that a person will develop the disease, these factors can contribute to an individual's overall risk. Gender. Breast cancer is much more common in women than in men. Men can also develop breast cancer, but it is relatively rare. Age. The risk of breast cancer increases with age. Most breast cancers are diagnosed in women over the age of 50. Family history and genetics. Having a close blood relative, such as a mother, sister, or daughter, who has had breast cancer increases the risk. Additionally, certain gene mutations, such as BRCA1 and BRCA2, significantly increase the risk of developing breast and ovarian cancers. Personal history of breast cancer. A person who has had breast cancer in one breast has an increased risk of developing it in the other breast or the same breast again. Hormonal factors. Prolonged exposure to estrogen and progesterone can increase the risk of breast cancer. Factors that may contribute to hormonal exposure include early onset of menstruation, before age 12, late onset of menopause, after age 55, and long-term use of hormone replacement therapy, HRT. Reproductive history. Women who have never been pregnant or who had their first pregnancy after the age of 30 may have a slightly higher risk of developing breast cancer. Additionally, starting menstruation at an early age or experiencing late menopause increases the exposure to hormones and may elevate the risk. Dense breast tissue. Women with dense breast tissue, visible on a mammogram, have a higher risk of developing breast cancer. Dense breast tissue can also make it more difficult to detect tumors on mammograms. Lifestyle factors. Certain lifestyle choices can influence breast cancer risk. These include excessive alcohol consumption, obesity, especially after menopause, lack of physical activity, and a poor diet. Radiation exposure. Previous radiation therapy to the chest area, especially during childhood or adolescence, can increase the risk of developing breast cancer later in life. Note that having one or more risk factors does not mean a person will definitely develop breast cancer, and some individuals without any known risk factors can still develop the disease. Regular breast cancer screenings and early detection strategies are vital for all individuals, regardless of their risk factors. Symptoms. The symptoms of breast cancer can vary from person to person. While some individuals may not experience any noticeable symptoms, others may have one or more of the following signs. Lump or thickening. The presence of a new lump or mass in the breast or underarm area is the most common symptom of breast cancer. It may feel different from surrounding breast tissue and can be painless or tender to the touch. Changes in breast size or shape. Breast cancer can cause changes in breast size or shape. One breast may appear larger or lower than the other, or the breast may become asymmetrical. Nipple abnormalities. Changes in the nipple, such as inversion, turning inward, or retraction, pulling inward, can be a sign of breast cancer. Other nipple changes may include redness, scaliness, or the development of a rash around the nipple. Nipple discharge. Spontaneous nipple discharge, particularly if it is bloody, clear, or persists without squeezing the nipple, may indicate breast cancer. Breast pain or discomfort. Breast cancer can cause pain or tenderness in the breast or nipple area. However, most breast pain is not associated with cancer but may be due to other causes. Changes in breast skin. The skin of the breast may become dimpled, puckered, or develop a texture similar to orange peel, peau d'orange. Redness, swelling, or thickening of the skin can also occur. Swollen lymph nodes. In some cases, breast cancer may spread to the nearby lymph nodes, causing swelling or a lump in the underarm area or around the collarbone. It's important to note that these symptoms can also be caused by non-cancerous conditions. Early detection and prompt medical attention are crucial for improving breast cancer outcomes. Regular breast self-exams, clinical breast exams, and mammograms are important for identifying potential signs of breast cancer. Diagnosis. Breast cancer is usually diagnosed through a combination of methods, including mammography, X-ray of the breast, ultrasound, magnetic resonance imaging, MRI, and biopsy. Stages. Breast cancer is staged based on the size of the tumor, whether it has spread to nearby lymph nodes, and whether it has metastasized, spread, to other parts of the body. The staging helps determine the appropriate treatment options and prognosis. Treatment. Treatment for breast cancer depends on several factors, including the stage of cancer, the characteristics of the tumor, and the patient's overall health. Common treatment options include surgery, such as lumpectomy or mastectomy, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and immunotherapy. Prognosis. The prognosis for breast cancer varies widely depending on the stage and other factors. Early detection and treatment can greatly improve the chances of successful outcomes. Prevention and screening. While it may not be possible to prevent breast cancer entirely, certain lifestyle choices can reduce the risk. These include maintaining a healthy weight, regular physical activity, limiting alcohol consumption, and breastfeeding. Consult with healthcare professionals for personalized information, as they can provide detailed guidance based on an individual's specific situation. Thank you for watching. Subscribe for more.